www.healthcmi.com. Acupuncture continuing education online. Today, acupuncture reduces post-stroke depression, restores function. This research came out of the Shanghai University of Traditional Chinese Medicine. What people forget is that not only after a stroke do people have functional impairment. Maybe they have trouble speaking or moving the arms or legs, things like this. But they also may experience severe depression. This is an enormous lifestyle change to undergo a stroke, survive, and then have yourself resting in a bed, sometimes unable to speak or move your limbs properly. And the road ahead is a fight to gain back that neurological function. In that setting, it is not uncommon to have stroke-related depression, not only from the neurological deficits from the stroke, but the stroke itself may also affect the brain in a way that induces depression. So, unfortunately, this is a double-edged sword wherein the stroke may affect the brain, causing the depression, but also the circumstances and impairments caused by the stroke will also lead to depression. This is something that needs to be attended to, and here acupuncture really helped. They used the Hamilton Depression Rating Scale to measure results for relief from depression, and then the MES scale, the Modified Edinburgh Scandinavian Stroke Scale, to measure restoration of neurologic function. The results were pretty good. Acupuncture outperformed a medication group in all parameters for functional recovery and for depression. Both groups received equal medication levels, but the medication group only did not perform nearly as well as the acupuncture group. So adding acupuncture into the usual care protocol produces significantly better results. So to optimize the treatment, acupuncturists need to get in there immediately. Really, once the bleeding has stopped, the cerebral bleeding has stopped, once the patient is stable, that is the time to begin. Many studies show that timing is everything. The faster an acupuncturist applies treatment repeatedly, the better the outcomes. In this research, it is documented very clearly exactly which acupuncture points to use. They use a primary set of acupuncture points across all patients with standard scalp acupuncture points like Bai Hui and Su Shen Sung, so MH1 and GV20, and other body style points. And also, this study allowed for secondary points to be added for special situations, and they outlined that very clearly. So it's a nice protocolized study with exact details for acupuncturists as well. People can get an idea of what they can expect and what those outcome measures will be. Take a look. It's at healthcmi.com, so go there, click on news, and look for the article entitled Acupuncture Reduces Post-Stroke Depression, Restores Function, published March 15, 2019. Thank you for listening. www.healthcmi.com.